Welcome to the Vital Living Forum on Parkinson's treatment, 10 secrets to a happier life. No one wants to hear the words, "you have Parkinson's disease," but as many as 60,000 people in the United States are diagnosed with the disease every year. In this country alone, about 1 million men and women are living with Parkinson's disease, and it's estimated that up to 6 million people suffer from the degenerative condition worldwide. According to the Center for Disease Control, complications from Parkinson's is the 14th leading cause of death in the U.S., and studies show that the number of Parkinson's sufferers will rise significantly by the year 2030. Currently, there's no cure for this disease, but there is hope as scientists continue to work towards a cure and make progress in identifying better treatment options for patients. Joining us is Dr. Michael Okun, co-founder of the University of Florida Center for Movement Disorders and Neurorestoration and National Medical Director for the National Parkinson Foundation. Dr. Okun is considered a world's authority on Parkinson's treatment, and his publications and blogs offer a voice to empower people living with Parkinson's all over the world. Today we'll be discussing Dr. Okun's latest book, Parkinson's Treatment, 10 Secrets to a Happier Life. Welcome to the Vital Living Forum. I'm Katie Dagenais. So we're going to be talking here about your book, 10 Secrets to a Happier Life. So start off, introduce yourself to us, and then we'll get into talking about your book.
Sure. Well, thank you for having me on your show. I'm a neurologist by training, but I also did a couple of years of training both in movement disorders and an area of the brain that's called the basal ganglia, which controls movement and emotion and mood, as well as training in putting probes in people's brains in these types of more advanced surgical approaches for movement disorders. And so I've spent my career taking care of people with Parkinson's and related disorders and disorders of movement, and I've had the pleasure and honor of not only participating on the research side, but lecturing all over the world and talking to people and trying to understand what the needs of the community are and take them back to the laboratory and develop, better treatments and better approaches.
So tell me about this book, Parkinson's Treatment, 10 Secrets to a Happier Life. How did this come about?
Well, I've traveled extensively and really had a tremendous honor in my lifetime to meet a lot of people who are suffering with Parkinson's disease, and I'm impressed whether I'm in Asia or in South America or in the United States, whether I'm in Sioux Falls, South Dakota or Atlanta, Georgia. It really is a common disease, and you see Parkinson's disease no matter where you go on the globe. It doesn't seem to pick on one culture or one group of people any more than another. And the most common, risk factor for Parkinson is age. So, as a neuroscientist, if we make people live forever, we're all going to be stuck with diseases like Parkinson's disease. And what occurred to me in seeing these patients and in working with them on treatment strategies and working in the laboratory is that there's a whole bunch of things that people can do to lead a happy life with Parkinson's that they're not doing, some of which might seem, obvious, but we're clearly not getting the word out because we need to make sure that we are, delivering that message. And so the purpose of the book was to deliver the message, and I've been blessed to train a lot of people who are now, neurologists and neurosurgeons and neuroscientists all over the world, and they've helped me to translate this into over 20 languages. And so
Wow.
the idea is we're trying to help, to get the information out.
And we'll get into the 10 secrets and some of the details of the book. But let's go ahead and start from the very beginning, explaining to people what is Parkinson's. I think a lot of people know the name, but then if they're asked really what is it, it's a little fuzzy. What is Parkinson's disease?
So it's a great question and a really good starting point. And Parkinson's disease, in a very basic sense, is a neurological disorder mainly of the brain. And what happens is that there are some cells in the brain and also some circuits, so just like you have circuits in your house that connect the lights and connect different cords and different pipes go different places, you can have in neurological disorders, so in brain disorders, some of these pipes and some of these cells in very simple terms can start to act awry and go awry. And in Parkinson's disease, what happens is there's a slow degeneration or loss of cells and some of the pipes that connect the cells in many regions that control motor function, so things like tremor and stiffness and slowness and walking, but also a lot of people don't appreciate non-motor function. So Parkinson's also affects depression, anxiety, sexual dysfunction, and things that are not typically thought of as part of the syndrome we now know are affected with this disease. And so you see a slow degeneration, a very slow degeneration of these circuits, multiple motor and non-motor circuits, and chemicals. And the most common chemical associated with Parkinson is loss of a chemical called dopamine. But there are several others like, norepinephrine and acetylcholine, and these are big names and not important to know, but it's just important to know that it's a very slow degenerative process that results in both motor features, tremor, stiffness, slowness, and non-motor features, depression, anxiety, sleep problems.
Now, I think when we talk about degenerative conditions, neurological degenerative conditions, people often think of Alzheimer's. They're different, obviously.
Yeah. Well, one of the secrets, and the first thing I always talk about is these shouldn't be secrets. So, the whole point of the book is let's decode these and get the word out. But the most important thing is to know the signs and to understand what is Parkinson's and what is not. And when I talk to patients, they often tell me that those words, I have Parkinson's or you have Parkinson's disease, those words are gonna, they're gonna pierce the hearts and drain the dreams of 50,000 people, worldwide or more per year. And so a lot of people are gonna get diagnosed with Parkinson's. And when I talk to them in the clinic and I say, what does that mean to you when somebody says you have Parkinson's? They will say, almost without pause, Alzheimer's, I have Alzheimer's, and the two are often confused. Mm-hmm. They'll say, it's just like having Lou Gehrig's disease or ALS. They'll say it's like a brain tumor or like a stroke. And actually, Parkinson is none of those things. And in fact, if you were going to choose something to have, Parkinson might be one that you would choose, and people don't quite completely understand, because we haven't done a good job in educating them, that Parkinson's isn't such a bad diagnosis. It's quite livable. Mm-hmm. There are good medical treatments, behavioral treatments, and sometimes surgical approaches and team approaches that can really change people's lives. It's quite livable, and when we study it, we have patients in our registries that are living, we call them PD20s, 30s, 40s. Well, what does that number stand for? It means they live 20, 30, 40 years with this disease. And so if you get a diagnosis of Parkinson, and some people are young with Parkinson, below the age of 50, if you get a diagnosis of Parkinson, it's not the end of the world. There are a lot of worse things to have, and it's not Alzheimer's, and it's not Lou Gehrig's disease. And we try to teach people that, that this is a very livable disease, and we can help you.
So let's go ahead and start with, what are the early signs of Parkinson's disease? And you mentioned a number of different degenerative conditions, but for Parkinson's disease specifically, what are the early signs?
Well, it's a great question, and there are a number of important research studies that have helped to open our eyes a bit about early signs of Parkinson's, and it turns out some of the earliest are loss of smell, loss of a sense of smell, and some people complain they can't smell pickles or bananas or licorice or a few common smells. And some people will act out their dreams and have very vivid dreams. We call that rapid eye movement disorder, sleep disorder. And we have other people that will develop a little bit of tremor, a little bit of stiffness, maybe their handwriting gets a little smaller or they're shuffling their steps. And so no two Parkinson patients look alike. And in fact, everybody thinks Parkinson's is tremor, but guess what? 1 in 5 patients with Parkinson's actually don't have a tremor. So, so everybody's a little bit different, and it's not a one-size-fits-all. And the diagnosis is often missed because there can be so many different symptoms that people present with.
Now, I know you said you travel around the world and meeting people with Parkinson's, and it selects all different types of people. Is it more common in particular age groups or racial backgrounds, gender?
Yeah, so when we think about Parkinson's disease as a worldwide, I like to call it an epidemic. It's not an infectious disease, per se, but it's growing in epidemic proportions. And when we think about the disease and we think about how many people it afflicts and who it afflicts, the most common risk factors for it are age. We can't avoid that, right? We're all going to get older. Right. And as you get older, you may get Parkinson's symptoms just from normal aging and cell loss in your brain, okay? And so this is sobering as we're making people live longer. I mean, my job as a neuroscientist is to make people live longer, make people live healthier. So if we keep doing that, we're going to have a generation of people with Parkinson's. And it affects more males than it does females. So more men than women, but otherwise it crosses all cultures. It's everywhere in the world, and all races have Parkinson's disease. And so it's a common problem, and one that we really need to address, because if we look at the growth of Parkinson in the world's 8 most populous countries, it's actually going to explode. It's going to go from 5 million or so in 2005 in people over the age of 50 in the world's 8 most populous countries to almost 10 million.
Wow.
Okay, in a very short period of time. And we all know there's more than 8 countries in the world. We all know that people get it below the age of 50. And so we're talking about large numbers of people that will be affected with the disease.
Now, if someone suspects they may have Parkinson's, what are their first steps? How do they go about getting evaluated?
So one of the most important things that you can do is try to ring up a neurologist. And there are lots of good studies, and one that was done recently by Allison Willis when she was at Washington University, where she showed that actually having a neurologist with Parkinson's disease, even a general neurologist, not specialized in that area, actually reduces morbidity, reduces side effects, improves quality of life, keeps people out of nursing homes, and reduces fracture rates. And so the first thing I always tell people is try to get a neurologist on board. The second thing is if it's possible to get to a center where they have some specialization, some interdisciplinary specialization in Parkinson, to try to interface with that, because the disease isn't just about the doctor. And I always say in our center that it is not the doctor is the sun and the patient revolves around the doctor. It's the patient should be the sun. And all of these services, physical, occupational, speech, swallow, neuropsychology, social work, should all be working together along with a doctor to provide the best care. Because remember, we got motor symptoms and non-motor symptoms. So if we're going to help people to live better, we've got to look at them as a whole patient.
So how is Parkinson's disease then diagnosed after evaluation?
So it's really an important point. And a lot of people are going to their doctors and they're thinking, okay, I want to get a diagnosis of Parkinson. Why don't you run the $1 million test on me? Give me the blood test, give me the imaging test. The single best way to diagnose Parkinson is by just an expert opinion at the bedside, somebody that knows Parkinson's disease, can examine you carefully, sees how you respond to medications. Now, there are some very expensive tests and imaging studies and things that can be helpful, but the gold standard is still getting to somebody that understands the disease, makes the diagnosis, doesn't need to spend millions of dollars on it, get you on the right therapy and put you on the right track. And
you say in your book, timing is critical. Correct?
Yes, the timing is absolutely critical with this disease, and it's different than in other things, and people may not appreciate that because we're given a pill by a doctor and we just take it, and sometimes we forget, or we take it a few hours here or a few hours later there. But in Parkinson's disease, the timing of when you get your medications will impact your response and impact how well you do. And it's unlike anything that people have ever seen before. When you take a dose of dopamine, people actually turn on. Tremors can go away, they become less stiff, they're able to walk. And if you've ever seen the movie Awakenings with Robin Williams, those are people that got a Parkinson-like syndrome after a flu epidemic. It wiped out some of those cells we talked about that are important in the brain for bringing out some of these symptoms, and they took dopamine and they got better. So these patients actually feel on, and the medications have to be optimized, but everybody's always looking for, I want the purple pill, I want the white pill, I want the blue pill, give me the fuchsia pill. And the trick with Parkinson's isn't so much which pills or how many or all these things, it's getting them at the right time and the right dose over time. And so working with your doctors and your teams to make sure that they're implementing the right strategy, and you're going to change over time. It's a dynamic disease. And if they can change and get the timing right, you're going to do much better.
Okay. Now, another critical breakthrough therapy, something you talk about in your book, is deep brain stimulation, or commonly referred to as DBS. How does DBS work?
So DBS is, I like to say, making your brain electric, or making the electric brain, and you would think, okay, let's push a little bit of electricity into the brain. This must be some snake oil or crazy thing. We're going to drill a hole and put a little straw in and push some electricity through and connect it to a device like a cardiac pacemaker, but the wire is going to go up to your brain and not to your heart, and in some magical way we're going to be able to set the device and it's going to improve your symptoms. And you would say, well, this is crazy, like why would you come onto my program and tell me about such craziness? And when I started my career in this, that was the general notion. But we now know when you apply electricity to the brain, we're affecting circuits. And if we tap into circuits in the brain, it's unlike any other area of the body. There are all these islands in the brain that are all talking to each other. And actually, they're all there and in pretty good shape in Parkinson's disease, but the conversations between them are sort of abnormal. We call them pathological. They're not talking to each other right. So we tap into the circuit, and that's one of the things I've done in my career in the operating room. We listen to these cells, we figure out the abnormal conversation, we eavesdrop on them, and then we try to use the electricity to change the conversation and make it more normal. And by doing so, it improves the symptoms in the patient. And we now know by multiple studies, by our group and many others, there are multiple mechanisms. There are physiologic changes, there are the blood vessels change when we turn on the stimulation. The connective tissue dumps out, these nice chemicals like adenosine and glutamate, and when they get eaten up, by the nerve cells, tremor goes away. There are new brain cells that get born around the electrical current, and where the brain oscillates, so the brain has an oscillation, changes to a more positive oscillation, and people's symptoms get better. And it's miraculous, but there's really something to putting this amount of electricity into a small region of the brain, done very carefully in select patients. It can't be done for all patients with Parkinson's, and I want to really emphasize that. But if you choose, specific patients who have symptoms that are really amenable to this type of therapy, it can really be very helpful and life-changing.
Now, before we go to a break, tell us a little bit about the research that you're doing at the University of Florida with DBS.
So we've been involved in this. I've been involved my whole career, and we're very interested in tapping into neural networks. And so we like to record out of different regions of the brain, encode what I like to call brain signature patterns. So maybe there's a signature for walking, there's a signature for tremor, there's a signature for many other symptoms. If we can understand these signatures, then we can use many of the assets that we have on the ground at our university and in our lab to try to actually have devices understand the signals as they're coming out of your brain and respond to them in real time. So you're an awake behaving human, something happens, you have a symptom, the device should be smart enough to respond to that symptom. And so a lot of our research is in that area. We've done a lot of work with other diseases besides Parkinson's. Tourette syndrome is one that we've worked on the network for 10 years in my lab. We work on obsessive compulsive disorder like Howard Hughes disorder and reward-based neuropsychiatric symptoms and tremors, and another movement disorder called dystonia and one called chorea. But a lot of what we've learned from Parkinson's about the circuits have given us the courage and also inspiration to try to take some of these therapies to help other patients with other diseases.
Well, it's fascinating. Dr. Okun, stay with us. We're going to be right back after this break. So let's take a short break, and when we come back, we will continue our discussion with Dr. Okun, a world-renowned neurologist and lead researcher of movement disorders, as we explore his latest book, Parkinson's Treatment: 10 Secrets to a Happier Life. Stay with us. Welcome back to our Vital Living Forum. Returning for our second segment is Dr. Michael Okun, co-director of the Center for Movement Disorders and Neurorestoration at the University of Florida and National Medical Director for the National Parkinson's Foundation. We've been discussing Dr. Okun's new book, Parkinson's Treatment: 10 Secrets to a Happier Life. In our first segment, we talked about the importance of early diagnosis and appropriate treatment as critical secrets to success for someone with Parkinson's. In this segment, we'll look at common symptoms and ways to manage them. Dr. Okun, thank you for staying with us.
Thank you.
So in your book, you talk about their journey is your journey. What does that mean for you?
Well, it's really important, I think, that people appreciate. It's like Lu Xun, a very famous Chinese philosopher, said that as people walk if there's no road there. When many men and women walk, together they make a road. And I think for Parkinson's patients, it's a journey. And a lot of people, they don't appreciate that it's not like Alzheimer's disease or other problems that can, have very short courses, that they can actually live a long time and live a long, happy life with Parkinson's. So we need to make this a journey. We need to get on that road as they're making it and forging the road, and walk it with them together and help them to get better quality of life.
So that journey starts with an evaluation and diagnosis. So what are the symptoms?
So the symptoms that we want to be sure that we review when we see patients in the clinic or talk with them on the phone or interact with them in a web-based forum is we want to know, are you having any tremor, which you don't have to have for a diagnosis of Parkinson's, stiffness, which we call rigidity, slowness, which we call bradykinesia. So, neurologists give long names to things so they can bill for them and sound really smart. But, so bradykinesia is slowness, stiffness. We look for tremor. We want to see if they're shuffling with their feet at all. We want to know if their balance is off, their handwriting has become small. But some early symptoms that people may not realize are things like constipation is very common, can be an early symptom even before the motor symptoms. Smell problems, sleeping problems, and then depression, anxiety, and lots of these non-motor features that can impact their quality of life. And so, this is not a 5-minute interaction with patients who you're worried might have Parkinson, because no two patients look alike.
Okay. What are some common ways, when we talk about depression and anxiety, what are some common ways to manage that as you're going through the diagnosis of Parkinson's?
So I think the first and most important thing to stress with patients is that if you are depressed or have depressive symptoms and you don't quite make it to a diagnosis of depression, but you have depressive symptoms that are getting in the quality of your life or have anxiety, this isn't just because you're having some reaction or you're feeling bad because you got diagnosed with a disease. This is the actual disease itself. And we know this now biologically, that the chemicals are changing. That's what's causing the symptoms. So the first thing I always do is I want to stress and explain to patients that phenomenon so they don't feel like, they have some stigma, about taking treatment. Behavioral treatments and medical treatments, there are multiple drugs and multiple behaviors. And in fact, when you put the two together, they act synergistically, very easy to use, need to be monitored, and you need to make sure that we get patients out of depression. When we lift that veil of depression and we treat anxiety and we treat sleep and all these non-motor features, it actually impacts the quality of life. Multiple studies have shown this, believe it or not, more than treating the motor symptoms.
Okay.
So we see these people shaking, stiff, slow, shuffling their feet. We're thinking, okay, let's treat that.
Right.
Turns out if you don't treat the other part affects quality of life more than the motor features.
And I would imagine that quality of life is also impacted by sleep challenges. That's something else that Parkinson's folks will suffer from.
Yeah, and I often tell people, you can sleep away your problems with Parkinson's, but if you're not getting a good night's sleep, you're not going to have a good day the next day. You're going to be tired, you're going to be sleepy, you're going to have something they call excessive daytime sleepiness or fatigue. And it turns out if you look across Parkinson's patients, the majority of them have sleep disorders, and we don't address it. We know it from the studies, but for some reason we haven't translated it and let people know that, hey, you know what, if you're tired during the day, if you're feeling fatigued, if you're dragging, it might be because you have something like sleep apnea, or it might be that you're acting out your dreams. That's the most common side effect or most common sleep disorder that we see in Parkinson's. And guess what? It's treatable. Sometimes we can treat it with a little bit of medication. Sometimes we need a sleep study and some other, means to get it treated. But I'll tell you, once you get somebody sleeping at night, they may not even realize they have a sleeping disorder. They're going to love you forever.
Right.
So I'm talking to all the doctors out there with your Parkinson's patients. They're going to love you forever because once you get people sleeping, they start having good days the next day. It completely changes their lives.
And I've heard of sleep hygiene. What is that?
So sleep hygiene is, people talk about dental hygiene and all these things that you're supposed to do that are sort of the right things to set yourself up for success, the steps to success. And so, these are things that you can talk with your neurologist about, like not keeping the TV on while while you're in bed, using the bed only for sleeping, and your activities around bedtime. And what they want to do is have a dialogue with you about how you approach sleep. And there are certain things that you can do behaviorally to help with sleep. There's also certain tricks with Parkinson's disease, and many people don't appreciate that if you wake up in the middle of the night, it might simply be that your dopamine level has dropped.
Okay.
You take a dopamine pill, and bang, you go back to sleep. Or you can stay up all night long and wait till the morning till your dose comes around. So there are just these very simple things that can help patients.
Now, another Parkinson's symptom that you explore in your book, addictive-like behaviors. What are those?
Yeah, so this is, something that's absolutely critical for people to appreciate, and something that the field has turned away from until recently. Thinking about Parkinson's and Parkinson's patients having addictive-like behavior. Oh, no, there's no way that can happen. This is not an addiction. But it turns out that dopamine is a chemical in the brain. Dopamine is part of the reward center. Okay, so when you get a pulse of dopamine, that's what happens when you're getting that chocolate, or you're doing something that you really like, and the brain responds in context. And so when we give dopamine, some people, and we believe it might be genetic, it might be the way that your wires are set in your brain. Some people, when you give them dopamine or drugs called dopamine agonists, will have these addictive-like, behaviors, and they can be excessive shopping, gambling, hypersexuality, maybe binge eating. And of course, people are embarrassed about that kind of stuff. But dopamine agonists as one class of medications cause these impulse control disorders, or addiction-like syndromes was the term that you used. And 1 in 5, 1 in 6 patients are going to get it on those drugs. It can change lives, it can destroy marriages, it can change the whole outlook for how a patient is dealing with their life. And so it's up to us, both as treating doctors, but also it's up to us to make sure we're reaching into the patient's lives and making sure that none of this is happening, because a lot of times people are embarrassed and they don't want to tell us. And we've seen lots of examples of ruined marriages, people spending their fortunes out by gambling. You take them off the medication, switch them to a different strategy, they do great. And so people need to be aware of this.
So what are some of the medications that you prescribe for handling these symptoms and side effects?
So actually, one of the best ways to handle it is to switch the class of medications. The most common medication that's causing a lot of these difficulties is called dopamine agonists. Okay, so that's about 1 in 5, 1 in 6 people get some of these things. And so just slowly getting people off of these drugs can be helpful. And sometimes they get a withdrawal syndrome when they're getting off these drugs, and so they need to be managed in other ways. So it can be very complicated. And so this isn't for the general doc. This is really, you really want to get somebody who has some specialty knowledge in neurology, a neurologist or a movement specialist to help. Even regular dopamine in 1 to 2% of cases can cause an addiction and a craving and addiction-like syndrome. And it can be very difficult either to adjust patients' medications or stabilize them with other meds to get this treated. And so it takes a lot of attention, and it's a really important thing that can destroy people's lives. And I've seen it happen. I've treated thousands of patients, and so I always tell people, when we're putting you on these therapies, realize if this pops up, don't be embarrassed. Give us a call right away so we can take care of it.
Okay. In your book, you say, we need to understand how to harness the power of exercise therapy. Exercise therapy, why is this so critical?
Well, if you look back historically at Parkinson's disease, before there was dopamine in the late 1960s, a lot of people were put into asylums or put into homes, and they didn't have a lot of treatments. And so they would have the patients push the chart racks and fold towels and do physical things. And many of the docs and many of the nurses, they began to observe, gosh, these patients are doing better when we have them exercising and moving around and doing activities. So they started making the patients, push the chart rack on rounds for the doctors and things. And so we now know, over the last 5 or 10 years, there's an expanding literature that now tells us that exercise is like a drug. And in fact, when you exercise, what happens is that cells begin to secrete what's like Miracle-Gro on the brain. And we call this like neurotrophic factors. And when these neurotrophic factors they enter on top of, critical regions of the brain, we can improve symptoms for patients, and not only motor symptoms, but also non-motor symptoms and depression and anxiety. And almost every single exercise study you'll read in Parkinson is positive. There are tremendous positive benefits. And so we've sort of, you realize that, hey, just like deep brain stimulation, there's some science behind putting funny electricity in the brain. There's some science about having your patients exercise. And so if it's possible, we like to have people exercise every day.
Very good. So we've been talking about a wide array of symptoms and treatments. So how do you effectively manage all of these?
Yeah, so I think, one of the most important things to remember is that this is a team sport, okay? This is interdisciplinary, and most of healthcare that's delivered in the United States is consultative care. It's one and done. You're lucky to see your doctor. Could you possibly see a therapist or somebody else you need? Could you see them on the same day? So we need to move toward multidisciplinary, having multiple disciplines working together. And the highest level of care is interdisciplinary. So in our center at the University of Florida, we have a completely interdisciplinary approach where the patient is the sun and we revolve around the patient.
Right.
Not the doctor, but the patient is the sun, and getting everybody to work together to integrate services and play their part to try to help patients. Have patients understand this is a broad disease, affects a lot of motor, non-motor symptoms, but also social issues. Marriages, you want to keep people married, you want to help them to live happy lives and to move into the sunset, but they're going to have many years in front of them. And so, the one thing that I've learned is to take a step back, and as a doctor and as a scientist, I'm just one member of a team, and we need to do better in helping these patients.
And one of the things that you've talked about and that you practice at the University of Florida at the Center for Movement Disorders is that patient-centered care, where the patient is the sun and everything revolves around it. It's critical.
It's absolutely critical. It works. It changes health outcomes. And it's something that's really important for people to understand. I often joke and I tell people, the best thing that can happen to you is to have people talk about you behind your back. And they say, oh, wait a minute, I don't want to have anybody talk about me behind my back. No, what you want to do is you want to see all these specialists and you want them to be meeting and talking about you and planning and plotting, because it's their job to put you on the right track to a better life. Okay, your job is to go live your life. We don't want patients, sitting around worrying. We want patients to have hope, to have happiness, and to have a plan, and to feel confident that, if something happens, they can tell us about it. We can get the right members of the team to mobilize. We can help them and plot the solution and have them move forward.
Now, I know with even that team focus, you say it's a team sport, there are cases where patients do have to be hospitalized. How do you prepare them for that?
So it's really absolutely critical that people know that in studies that we've been a part of with National Parkinson, 1 in 3 per year, there's a 30% chance of being hospitalized if you have Parkinson's disease. And so it's very common, and it's a very good chance that you're going to go to the hospital. You've got to be ready. Okay, just like when you're about to have your first baby born, you're a little bit out of your mind, you're not sure what to do, you're not in the right head at that time, and that's what happens right before you go to the hospital. Something's happening, everything's swirling around you, you can't really think straight. And so what we've done at National Parkinson is we put together a kit, and the kit is just like the bag that you pack to go to the hospital when you're having your first child, okay? It has all the things you need to survive that hospitalization. Well, it turns out nobody in the hospital knows how to handle Parkinson's. And unfortunately, we kill Parkinson patients in the hospital because we give them drugs like dopamine blockers, certain headache drugs like compazine and Phenergan. Block dopamine can be very bad for Parkinson patients. Certain drugs that move the stomach after surgery like metoclopramide block dopamine, very bad, can extend hospitalizations, lead to morbidity, mortality. Getting your drugs on time every time. Just little things, lots of little things can add up. And people in the hospital, they don't know. And so we've created a kit where they have rip-off pages you can hand to your doctor, hand to your nurses. It teaches them about Parkinson. You can advocate, for yourselves. You can help to educate the staff, make sure those orders are written, make sure you're getting your meds on time every time, and you're going to do well and succeed. But in the larger sense, we'd like to keep our Parkinson patients out of the hospital as much as possible so we can avoid issues that come up. But it's not always, something that can be achieved.
And are there drugs that Parkinson's patients should be avoiding?
Yeah, so there's a whole list of drugs. I write a blog for National Parkinson that's called What's Hot in Parkinson's, and I have, one of my past blogs is about just that, the worst drugs to take in Parkinson's. And there's a number of them, but the ones that we worry the most about are the ones that block dopamine, because that's such a critical chemical to Parkinson's, and there's several common headache and gastrointestinal for your stomach drugs that are great drugs, but if you have Parkinson's, those aren't the ones you want to be taking.
So tell us about this Aware in Care campaign that you talk about.
So Aware in Care was a campaign that was launched by National Parkinson Foundation. It was really inspired by all of this research from there's 43 centers of excellence around the globe that are sponsored by National Parkinson, and they got together, identified the problems with hospitalization, did a study, and have begun to collect information from all of these centers. And in one sense, it's nice to do studies, and I've done a lot of them in my career, but it's even better if you do a study, you get the result, and you put it into action. So we were able to understand what are the problems people are coming to the hospital for, what are the problems when they get to the hospital, what are the things that are most dangerous for patients, and we can put this all into a kit. We can give it out to patients. We've given out over 30,000 of these kits and continue to raise money to put more out there. They're free. You can call National Parkinson and get a copy of the kit. They have a 1-800-4PD-INFO helpline that has nurses, 24 hours, that'll answer questions. They'll give you a kit if you need a kit. And it's just wonderful services, for these patients.
All right, well, this is fantastic information. Dr. Michael Okun, you're going to stay with us, and you'll be joining us after the break. Your book certainly offers a lot of valuable information to anyone listening for answers about Parkinson's. And when we return, we will take a look at the current research on Parkinson's disease as we discuss Dr. Michael Okun's book, Parkinson's Treatment: 10 Secrets to a Happier Life. Stay with us. Welcome back to our third and final segment of the Vital Living Forum. We've been talking with world-renowned neurologist and researcher Dr. Michael Okun about his latest book, Parkinson's Treatment: 10 Secrets to a Happier Life. If you're just joining us, Dr. Okun is the co-director of the Center for Movement Disorders and Neurorestoration at the University of Florida and National Medical Director for the National Parkinson's Foundation. He also has an online Ask the Doctor forum and a blog called What's Hot in Parkinson's. Dr. Okun, let's go ahead and talk about the causes of Parkinson's disease. How do genetics come into play?
So genetics are really interesting and something that we're just beginning to learn about. And over the last 5 or 10 years, we've come to know through advanced DNA testing that there are a number of single pieces of DNA. DNA is what makes you different. It's your genetic makeup. We all have DNA, but if your DNA is a little bit damaged or duplicated or missing in certain areas, you can actually get certain diseases. And it turns out about 10% of Parkinson's disease patients have a single gene defect. And it's really interesting that 90% don't. And so we're trying to figure this out. Why is it that some people have a gene defect, but most people don't have a gene defect? And we believe, and we're coming to believe, that it's not just your DNA, but it's also the environment. And there's a great saying by University of California, Irvine scientist, and she used to say, the genes load the gun and the environment pulls the trigger. So you have some sort of genetic makeup, some sort of DNA makeup that puts you at risk for having Parkinson's disease. And then you get exposed to something maybe in the environment, and maybe that turns it on. And we don't quite fully appreciate how this interaction may work, but it's of great interest. The other thing that's really important is that the genes tell us something about what's going on in the brain and these abnormal cascades. And so these abnormal interactions that are going on, because the genes tell us about proteins that live in certain areas. And so we're learning about this disease by some of these genetic defects, but we're still at a very elementary understanding.
Now, when we talk about the environmental factors, are there certain chemicals that people should avoid to reduce the risk of Parkinson's?
Well, it's a great question, and we don't know for sure. We can't tell you exactly, but there are certainly things that are in the environment that have been linked to Parkinson's disease. Like if you have rural living, well water, we know that there are certain things like tetrahydroquinolones, which are in barbecue and other things that might be related to Parkinson's. That doesn't mean you should stop eating barbecue, because barbecue is great, right?
Right.
But there are other things like dry cleaning solvents, like there are, trichloroethylene, TCE, organophosphates, things that have really long names. And we used to think, okay, well, these chemicals, they don't have anything to do with diseases like Parkinson. But we now know, both in animal studies and in what are called human epidemiologic studies, where we look at the relationship of people who are either at risk for Parkinson or don't have Parkinson, who then get it later. And now we're seeing, in study after study, there is a relationship between the amount of exposure you've had to certain chemicals and Parkinson. And so there's something about this environment, gene relationship, and the environmental exposures that's important.
And I imagine finding the causes it's critical to figure out what causes it, at least in some cases.
Yeah, it's absolutely critical to for us to really unlock that understanding if we're going to adequately treat this disease.
All right, well, let's talk a little bit about your current research projects. What are you working on right now at the University of Florida?
So we're working on a number of interesting projects. We target both motor and non-motor symptoms, and we work on everything. Our staff, we have 45 interdisciplinary faculty, so I don't want to pretend like, I'm the one that makes it all happen. The magic happens with this really group of talented interdisciplinary folks, and we work on everything from drugs to behavioral therapies to treatments for motor and non-motor symptoms. We're very interested in symptoms that stop responding well to the Parkinson medications. And we listen to our patients, and they tell us, these are the things that are really important to us, and we try to focus our efforts. And we have lots of ongoing trials, over 30 trials of different types of therapies for patients, and we try to do things that are going to help them. And in the background, we're doing things in the laboratory to try to figure out how these diseases work, how we might be able to start talking about slowing down their progression, cures, and then of course studying the networks, how the different brain regions are talking to each other. So we're very busy, and we're very fascinated by many aspects of this particular disease.
Now, what about a vaccine? Is there a vaccine for Parkinson's?
Yeah, so actually there is now, and there have been several groups who are interested in this technology. And in very simple model is that what happens in Parkinson's is these abnormal proteins get deposited in the brain. And the proteins are made of something called alpha-synuclein. And different diseases of the brain have different proteins with different names. The one for Parkinson's is called alpha-synuclein. Some people call it Lewy Bodies. If you read chapters, you might hear that term, Lewy body. It's named after a neurologist named Frederick Lewy. You accumulate a bunch of these Lewy bodies, you get Parkinson's symptoms. So can we actually give a vaccine to block the immune response or block the buildup of these types of Lewy bodies in the brain? And can that be a viable approach for treatment? And that there is now a safety study that's ongoing of a vaccine trial, and we're eagerly awaiting the results of that.
All right. Now, one of the names that's often associated with Parkinson's, besides your own, is that of Michael J. Fox, the actor. What has he done for developing just awareness, general awareness, and for moving this disease forward and hopefully being able to treat it?
He's been a huge influence, and it's no question whether it's Michael J. Fox or Muhammad Ali or Janet Reno or any of the really important personalities and well-known figures that have influence and ability to put the word out, both for education and also to help to raise money and raise awareness. These people have done tremendous things. And so from him taking his career, going from Back to the Future and all the things that we love to see him do, and then transitioning and showing us, hey, I can live with Parkinson's disease, I can drive my kids to school, I can go on vacation, I can live my life. And this is a guy who's had it for over 20 years. And he's saying, look, I'm living with it, I'm fighting it, we're going to raise some money, and we're going to try to help with the research. And he's been absolutely critical on the research side of the equation, and I can't say enough about his contributions.
What has been your involvement with his foundation?
So early on, I got one of his very first grants that was given out, and at the time we were studying hormones and testosterone and Parkinson as a potential treatment. It didn't pan out, but it was something of interest, many years ago. And in the institute and center that I'm part of, we've actually had multiple Michael J. Fox grants, lots of great collaborations with the foundation over the years. And it also, brings together a lot of institutions that can work together on important projects. And the Fox Foundation works very well with the National Parkinson Foundation that I work with. And, we work synergistically to try to get the word out and help with research.
And I see on the back of your book you have Muhammad Ali. So it's definitely these top names who are really bringing some much needed attention to this disease.
Yeah, and Muhammad Ali makes the point on the cover of the book. He says, look, this is a disease that affects all cultures. It affects, all religions. It affects everyone, and we're not doing a good enough job getting the word out about things that we can do to help people to live better lives. And he's been an example of somebody for over 30 years, who has, stepped out and said, I'm not going to let Parkinson's stop me from living my life. And so he often says to me, there ain't no joking with Dr. Okun, and that's his funny little quip to say, he's telling you things to do, and these things might help you, and they might sound simple, but if you can be consistent, program them into your life, they can really, be very effective strategies.
Now, in your book, you recommend the patients ask the question, Doc, where is the research going? Why is it so important to ask that question? Yeah,
it's just absolutely critical that a patient realize that this is a dynamic environment. There are so many researchers all over the world, and every Parkinson patient looks different, and so their doctor needs to be attuned to what their symptoms are, what their problems are, what are the things that are out there that they may be eligible for, and they can participate in a trial and help to move the field forward. And many of these patients who have participated in trials with me and with other colleagues and partners over the years have just done terrific, and they've gotten access to a lot of these drugs early on, or their surgical approaches or behavioral approaches, and we can't do it without the patients. If they don't help and volunteer, we can't move as fast. And so I'll tell you, they've just been wonderful. The Parkinson patients are amazing, and they've given and they step up and they say, Doc, I'll be your guinea pig. And we have a responsibility to not hurt them, but we certainly want to bring them the best possible therapies.
So what does the future hold for Parkinson's? I mean, is it logical and possible that we'll find a cure for this?
So I like to think of it, maybe not quite jumping all the way to the cure. I like to think of Parkinson's disease in 3 buckets. So we have symptomatic, powerful symptomatic therapies that we're developing lots of, and we're getting better and better. We need to, like in this book, teach people how to implement these types of therapies and strategies in their life, because it'll make a difference now, and they can live a good long life with Parkinson. It can be a happy life. Powerful symptomatic therapy bucket, okay? Mm-hmm. The next bucket is disease progression, slowing disease progression. Can we slow it down? Turns out, and this may be a little bit of a morbid thought, but if you slow down these diseases a little bit, something else will get you. Prostate cancer, heart disease, or something. So if we could actually slow it down by 5 or 10 years, that would be a huge win. We wouldn't actually need to get to the cure for everybody. And then, of course, the last bucket is the cure bucket, and that's going to be hard to get to in the near future, and the reason for that is that Parkinson's isn't one disease. It's probably a group of symptoms that look similar but can be caused by multiple things. And so it might not be a one-size-fits-all. It may be more of a personalized medicine approach. And so I always like to think powerful symptomatic, slow the disease down, and then start thinking about personalized medicine for maybe curing some of these subtypes.
Well, and in the meantime, for someone who is diagnosed with Parkinson's, what are some tips that they should be following?
So the things that I think are absolutely critical for them is check in with your doctor frequently, okay? If you're not changing your strategies and your medications and everything is staying the same, you're dealing with a dynamic disease. You may not be maximized, you may not be optimized. Never be afraid of a second opinion. I'm never afraid of having one of my patients go out and see somebody else. I might learn something. And you should never be afraid to ask around and be an advocate. You're not being a pain or a nag, be an advocate. Get a good spouse, get a good family life, but don't focus so much on what you can't do with Parkinson's. Wake up and say, hey, I know this is a disease that's chronic, that I'm going to live with for a long time, and I can have a good life. So let's go have a good life, and let's do all the things we know that can get us, over the fence. And each morning when we wake up, if we get a new challenge, we'll jump that fence, and we'll get over that barrier and move on to the next challenge.
Now, you conclude in your book by saying, kindle hope into happiness and a meaningful life. Why are these words so significant for a Parkinson's patient?
I think it's always important to have hope, okay? And I think I have every reason to believe, in seeing thousands of these patients and seeing people succeed with this disease, that you should be very hopeful. And hope brings happiness. And so having faith and having hope and knowing your core values, of defining who you are. Parkinson's doesn't define you. You have to define your core values, who you want to be, and you still can bring hope and get to happiness even with this disease. And I think the hope will kindle the happiness and help you to move on that path, on that road.
Now, before we go, where can viewers go for more information about Parkinson's disease?
So there are lots of good places to go. There are several foundations. One of my favorite is, of course, National Parkinson Foundation. They have a website, www.parkinson.org.
Okay.
They also have a free 1-800 line called 1-800-4PD-INFO, 1-800-4PD-INFO.
Okay.
And then they have free web forums, so you can ask a question and get an expert to actually answer a question online. And I've run those forums for many years called Ask the Expert on the website, several blogs, the What's Hot blog, ParkinsonSecrets.com blog, lots of places you can get great information.
And where can people reach you? How can they reach you?
So I'm pretty easy. People always say, oh gosh, you actually respond and answer my emails or questions, or when they write a comment on Amazon about my book, I will write them back, or if my email's in the book, actually, it's right in there. I like to hear feedback about what do you want to hear. That's how I know as a scientist and as a clinician what should be the next question that we're asking. So you can email me, you can call me, you can call University of Florida, and we have a very nice access center for our patients. It's 352-294-5400, 352-294-5400 to get appointments with any of the many specialists we have. We have a big center now, and so I'm blessed to have lots of people around me that take care of Parkinson patients.
And if you could say one thing to someone who maybe has just been diagnosed, kind of words of wisdom as we leave today with regards to Parkinson's, what would you like them to know?
I would tell them that Parkinson's does not define them, that they can live a better life and they can find that road to hope and happiness with this disease. It's not Alzheimer's disease, it's not Lou Gehrig's disease, and we need to get a good short and long-term plan. And let me worry for you, and we need to get you back living your life.
And thank you, Dr. Michael Okun, for joining us today and for sharing your latest book, Parkinson's Treatment, 10 Secrets to a Happier Life. Very important information for people to know.
Thank you. It's been an honor to be on your show.
All right, thank you. And the Vital Living Forum is part of Orange County's Vital Living block on Vision TV. For more information, please visit us on the web at www.orangetvfl.net or contact the Orange County Office on Aging at 407-836-6563. I'm Katie Dagenais. Thank you for joining us.